hearing from Jason Kaiser, Executive Officer, Dr. Karen Brandon, Board President, and Dr. Dale Armstrong, Board Vice President, who I believe will be joining us remotely. So hopefully the tech works and we can get that rolling. And do we have Dr. Armstrong coming in remotely? Or is that maybe just going to be via phone call? I don't know how we're doing this. WebEx. Got it. We can see Dr. Armstrong. We'll get to, I'll defer to y'all on the order of your presentation. Please go ahead.
Thank you. Good morning, Chairs Berman and Wahab, and the distinguished members of the committee. My name is Dr. Karen Brandon, and I'm honored to serve as the president of the Physical Therapy Board of California. Thank you for the opportunity to appear today as part of our 2026 Sunset Review oversight hearing to discuss the board's work in protecting the people of California. The Physical Therapy Practice Act was established in 1953, and today our board is comprised of 7 diverse members, 4 governor-appointed professional members, 1 governor-appointed public member, 1 Senate-appointed public member, and 1 Assembly-appointed public member, and we currently have 2 vacancies. Our mission is clear: to advance and protect the interests of the people of California through the effective administration of the Physical Therapy Practice Act. Public protection remains our highest priority and guides every licensing, regulatory, enforcement, and outreach decision we make. The board currently oversees more than 41,000 active licensees, including physical therapists and physical therapist assistants, representing about 15% growth rate since 2021 when we were last here. We are well above the national average, reflecting continued expansion of the profession statewide. California is home to 19 CAPTE accredited physical therapy programs and 27 CAPTE accredited physical therapist assistant programs, all of which have a 90% or higher pass rate for the national board exam. We are doing our part in supporting a strong and growing workforce pipeline. In addition, the board recognizes 125 continuing competency approval agencies, helping to ensure that licensees maintain ongoing professional competence throughout their careers. Over the last year, we have continued to strengthen our core responsibilities, improving licensee efficiency, maintaining rigorous enforcement standards, advancing through thoughtful regulatory updates, and engaging proactively with the stakeholders. We recognize the challenges Californians and licensees face in accessing timely, competent care, and we remain committed to fostering a regulatory environment that balances strong consumer protection with practical workforce realities. We also value the collaboration of licensees, patients, educators, professional associations, and public members whose input actually strengthens our deliberations and informs sensible regulation. The board takes seriously its responsibility to be transparent, accountable, and responsive to legislative oversight. We are confident in the progress we have made and remain committed to continuous improvement in the service to the public. With that, I will turn over to our Vice President, Dr. Dale Armstrong, on WebEx to share further detail regarding the board's implementation efforts and stakeholder engagement.
Great. Thank you very much. And Dr. Armstrong, hopefully we can hear you. Unfortunately, we can't hear you. Does it happen to be muted on your end? And we lost video. We can see you, but I'm not sure we can hear you yet. Yeah, that's a good question. Can you hear us? You can hear us. Gotcha. That's half the battle. I assume it's. I don't know what tech support we've got behind the walls, but so I'm taking it that you're off mute on your end. Yep, but for some reason it's not working. Paging the magicians. We're not getting audio. Yeah. Thanks. So we will try to get this figured out. We've now exceeded my expertise. So I think we're going to try to see if maybe you can join from another device, if that's possible, or maybe sign off and re-sign in again. So our tech magicians, I think, are communicating with you to try to get it sorted out. In the meantime, we're gonna move forward, and hopefully we'll get this figured out as quickly as possible. Any additional comments in your presentation?
I would just say good morning, Chair Berman. Good morning, committee members, consultants, and staff. And thanks to all the IT folks in the background that are making this happen. And thank you for giving us the opportunity to participate in this sunset review. As the executive officer, the administrator of the board, I'd just like to highlight that the report that was submitted to the board or to the committee in support of its continuation is more than just data, statistics, and narrative. It reflects the commitment and ethic of this board's members and staff to the ongoing mission of protecting the people of the state of California, and more importantly, protecting the consumers of physical therapy services in the state. So whether it's through our application and licensing services staff, our consumer protection services staff, or the staff of our administrative and executive services unit, it's clear, as I think you'll see through the report, that they strive to live up to the vision being the standard of excellence in consumer protection. So while I have this brief moment of airtime, I'd like to thank them personally. I'm very proud of the job that they do, and it also makes my job as the administrator a little bit easier. I'd also like to extend thanks to our other partners in this mission, the Department of Consumer Affairs for their support, the DCA's Division of Investigation. Oh, closer. The Department of Justice's Office of the Attorney General, and our brother and sister boards at the Department of Consumer Affairs. So again, thank you, and we're happy to assist and answer any questions you might have.
Wonderful. Thank you very much. I'm going to turn it over to colleagues for any questions or comments that they might have. Senator Archuleta.
Yeah, thank you for being here. I'm so sorry we can't hear from your vice president, but I'm excited that you're here because physical therapy, after, it's rehabilitation. We all know that. And after the operation and everything goes done with whatever it is, physical, emotional, whatever it is, you're turned over to someone else. No longer have the nurse, the doctor, but now you have to take over. Tell me about the relationship you establish with the patients during the process when you finally get when they finally get released, and how important it is. And what exactly is your mindset when all this is going on?
Thank you for that question. As a practicing physical therapist, I do believe that the relationship and creating a safe and professional relationship with the patient goes a long way. Not only do you have to garner trust for the process, some things are uncomfortable, and some things are things that you're doing with a patient that are unfamiliar to the patient, but they have to believe you, not only in your credentials and your expertise, but that you actually care about them, right? So that relationship also transitions into how effective your practice and your recommendations are going to be with them, because many of those things have to go on to be lifelong practices that they do to maintain their level of function, to continue to improve physically. So it's both of those things are important: the ability to convey your expertise, but also the awareness that you care about the outcome and you care about them as people.
I would imagine some of the patients that are stroke victims, heart attacks. You know, we talk about physical therapy, knees, back, whatever, but these strokes and the ability to speak again and to move your hands again, that's got to be devastating for the patient and the family. Do you find that you have those that are a little more familiar with that type of work versus some of the others within the realm of your agencies?
Yes. So definitely, this is very close to home. My father sustained a stroke 3 years ago, very profound one, affecting multiple functions. In my practice and in my education as a physical therapist, noticing maybe even early signs of compromise of blood to the brain, we learn those early cues. Number two, going into the acute care and making sure that those providers are part of the medical team that helps the patient with early mobility and make sure they have good circulation, and also follows the practices that are necessary to keep people safe in the ICU. Moving forward to the rehab facilities, many of those therapists, physical therapists and physical therapist assistants, are trained in neurological rehabilitation. So it's not just getting somebody up and walking, it's how to engage and facilitate certain parts of the body that are important as the baseline to them being able to recover, whether it's working on trunk motion or working on their breathing or working side by side with occupational or a speech therapist to do collaborative care, and definitely making sure that the family is involved, right? And then, of course, there's home health services and outpatient rehab that continues to progress the patient to the fullest extent of their function. So not only have I had the opportunity of working in multiple settings and implementing those for neurological patients, but I've also been on the other side as a family member and seen the benefits, and I'm very thankful for those physical therapists that worked with my family.
I want to thank you again. I don't think we give you enough credit, and I certainly acknowledge, because I have family members who have gone through it, both physically, emotionally, and so on. And the therapist is the one that met him at the door and then said goodbye and just keep up the therapy. Well, thank you.
Thank you.
Thank you, Senator. Any additional, Senator Small-Cuevas?
Thank you so much. Good morning. My question has to do with AI. I noticed that in some of the reporting and materials that the use of AI is becoming more prevalent in your practice area. I would love to hear a little bit more about that. I always get concerned when we have AI being integrated into our healthcare field. We hear so often from nurses, for example, of wrong technology being wrong and too often overriding the human knowledge and expertise. So I'm just curious, how are you integrating this technology in? Are there particular consumer protections that the board feels is essential for us to consider, and particularly around making sure that there's proper enforcement too when these tools are utilized and problems arise?
First, I would say that AI is an emerging tool to be used by practitioners across all of healthcare, and we do see it in physical therapy. Really, when you look at things in the larger context, even delivery by telemeans is somewhat new, right? We've just experienced that over the last 10 to 15 years. Most importantly, during the pandemic, we saw that kind of rise in height and access. We utilize the same philosophy and enforcement for those type of complaints for telemedicine. Telemedicine is just a tool that the practitioner can use, but it should never replace the standard of practice. You can take that same idea or methodology and apply it to artificial intelligence. So we would hold the licensee practitioner who is using AI in that model responsible, and that fact checking and making sure, just like we provide guidance, or we also receive guidance from every large language model provider, that you should check it. It can hallucinate. It can be wrong, right? So our practitioners have to do the same thing. From the board's perspective, we also want to educate the public in kind of that caveat emptor mentality of buyer beware. We do see the emergence of the separation of licensee and AI, where the actual delivery is being done almost at the corporate level by an app of some kind or a website. And in those instances where we receive complaints, we investigate them like we would any other unlicensed practice complaint. And to the extent that we find physical therapy services being provided by one of those entities, apps or corporations, that's not actually tied to a human licensee, we would pursue that unlicensed practice route. I do predict in the future that that will probably become a more prevalent problem for us. And there might be some, maybe a greater deterrent than what we currently have in just issuing a citation to someone limited to a $5,000 fine for unlicensed practice, because that might not serve a great enough deterrent to those larger profit-bearing corporations. They might see that as a ticket to be paid. So,
I also want to say, the practice of healthcare in general is seeing a boost in 3 different areas, I would say, for AI. The first one, obviously, generative AI, which is your typical, hey, I have something wrong with my shoulder. What are the exercises I should do? And that certainly, as Mr. Kaiser says, the buyer beware. And we definitely want to make sure that consumers are aware, but also practitioners and licensees are not allowing these new innovations to replace the judgment that we, as the state of California, have put in that license for them to give to an individual. The second one would be predictive AI. So predictive AI is, okay, if this person has this problem and this problem, they likely need this thing. And certainly those are still in the works regarding research. We utilize a lot of it in statistics when we're doing predictive models for disease. But I don't think we're utilizing it currently with actual care. The final one would be assessment models. So the ability for us to put markers on a patient's body and be able to evaluate their gait and see if they could change something about their running speed or how they're utilizing certain muscles. And that really doesn't have a direct correlation yet with practice, but it's definitely another area that physical therapy is active in, that the AI wave.
Thank you very much. Any additional questions or comments from colleagues? Couple thoughts and a question. One, I've used AI to try to help kind of diagnose physical injuries. And I should say, I didn't appreciate physical therapists as much in my 30s as I do in my 40s. So I feel like I need one on standby these days, or I just need to stop exercising. But I felt like it did a decent job of helping me understand what injury I'd sustained. But then I've also used AI in lots of other ways where it's been so wrong. So I appreciate the buyer beware comment. We need to be that can be a good place to go maybe for an initial little guidance, but you've got to go get more professional advice. Especially when it comes to our bodies and injuries that we've sustained. Wanted to ask about issue 1, which is the issue of statutory caps. And looking at issue 1, the board's request for a statutory fee increase, what steps would the board take when increasing fees in regulations? For example, what would trigger the board to commence rulemaking? And I'll note that the board has asked for increase in the statutory cap before. It turns out it hasn't been needed. That's a good thing. It's a good thing that you haven't needed to increase the statutory cap in the past. But help me understand a little bit about the request this time. And in addition to that, how does the board handle opposition to a fee increase during the comment period?
Sure, I'll take that question. And you're right. I was before you this time 5 years ago asking for this cap, and I'm pleased to say that we didn't need it either.
It's a good thing.
Those anticipated costs are a bit of a stressor. So but times have changed a little bit. We have and are now struggling with just the general cost of living and cost of doing business that every other consumer in the state of California is experiencing. To your question about where we would go after a cap authorization was provided to us, through the promulgation of regulation process, staff would do a research paper into determining what the actual fee would be required to sustain operational need moving forward. You'll see in the briefing paper and in the sunset papers that we talk about our fund condition. And currently our fund condition is about 7 months, but projections show it kind of starting to diminish over time each and every year. As the administrator, I have had the unfortunate experience of having to raise fees in the past. And in that particular experience, we waited until we got down to a 3-month fund condition before we started that process. So I don't know that I would wait quite that long this time. But we would also take an incremental approach, right? So not the assumption being if that fee cap was granted, the assessment through the regulatory process would be much more specific based on operational need. What will we need to sustain operations moving forward? Because we can always address this issue in another regulation, past that point. What I see as kind of being an issue is that this board still suffers a little bit from growing pains in the size of its staff commensurate to the size of its licensing population. But I'm happy to say, as a profession and as a regulator of that profession, our population continues to grow year after year, and not all boards can say that. So, in that situation, with more licensees, you have the potential for more information sharing, more complaints received, more investigations, and have you, hence more costs. And that's where we find ourselves today.
Gotcha. Thank you very much. I know we've had a couple of additional colleagues join. Any questions for the Board of Physical Therapy, the Physical Therapy Board? Yes? Yeah, Assemblymember Alanis.
Yes, thank you, Mr. Chair. So if I may ask, the committee's analysis notes on page 27, the dry needling that's allowed in most other states, what has been the experience in terms of malpractice claims and licensing actions involving PTs who use this technique in states where PTs are authorized to use this technique?
So just for clarity's sake and to be clear, dry needling is currently prohibited for our physical therapists here in California. As far as malpractice claims pertaining to dry needling modalities in other states, I don't have that data, but I can tell you just anecdotally, malpractice claims for physical therapists are low in consideration of other healthcare practitioners. I know that also you'll see throughout the issues paper that we recently became aware of a modernization of the Practice Act bill by the California Physical Therapy Association. And one of the items that they are seeking in there is the authority for physical therapists in California to do dry needling. And it's something that we'll have to work with them, moving forward. It's been an ongoing topic for this board for about the last 10 years. We've had 2 stakeholder engagements about dry needling, just for clarity's sake. Just to make sure that all of our consumers, all of our licensees, and all of the licensees of other professions that have overlap understand what the actual laws say and if there are prohibitions for our practitioners being able to use that particular modality.
I also wanted to add, if it came to the rulemaking, if this actually became part of the Practice Act, we have really been engaged with multiple states in how they evaluate competency. I think that's really important. And also, what their relationship is with the other stakeholders in that state regarding the use of penetrative procedures.
I have one more, if I may.
Always.
Okay, thank you. So we've had some laws allowing patients to directly access physical therapy since 2013. And there's an analysis, again, and this on page 21. I'll just go straight over to states allowing it without the restrictions of California that has, which is the 45 days, the 12 visits, or whichever one comes first. What has been the experience in those states, if you guys know, and are there any data that shows that PTs are inappropriately treating patients or not referring to physicians or other providers when it's appropriate for the patient's conditions.
For direct access for those states that have true direct access, I can tell you that the data that I have available to me is it would be the disparity between complaint intake per population. And I don't see that in those states in particular that there are any kind of anomalies that cause me concern. When we did transition, I was here when we transitioned from no direct access to temporary direct access, and it was a little bit of a roller coaster ride, right? We thought that there was going to be a little bit of the wild, wild west, but I'll tell you that it didn't turn out to be that way, right? We were pleasantly surprised that 12 visits in 45 days worked so well in partnership and communication with the diagnosing physicians. And then we transitioned through the pandemic. And during that pandemic, access to care was a great issue. And one of the things that we made in a recommendation to our previous sunset is for that direct access, past that 12 days or 12 visits or 45 days, the patient would have to have an in-person consultation and evaluation by the physician and have the physician sign off on the plan of care before the physical therapist could continue care. You can imagine during the pandemic, that was practically an impossibility. And so one of the recommendations that we made was to shift from in-person to a telemedicine or a telemeans evaluation when clinically appropriate by the physician. That went into effect as a result of our 2021 sunset, and it also has worked very well.
I wanted to mention too, I think a big part of that change, if it happens in California, it really will be reflected in our ability for consumers to access us and to know what to expect when they have physical therapy and what they shouldn't expect. And we utilize a lot of online available messaging, and also the mandated requirement for all physical therapy practice in designated areas to have our access 1-800 number for complaints or questions or concerns. So I think it's also keeping the consumer aware so that we can maintain that connection and openness to any questions or concerns.
Hello, can you hear me now?
We can. We'll be with you in 1 second, but I'm glad we can hear you.
I'm good, Mr. Chair.
Thank you, Assemblymember Alanis. Any additional questions or comments from colleagues? Vice President Dr. Armstrong, we can hear you. We would love to hear your testimony.
Hello. Would it be all right with you for me to present my introduction?
Yes, please go ahead.
Thank you so much. Thank you, Dr. Brandon. My name is Dale Armstrong, and I am a professional member of the Physical Therapy Board, and I currently serve as Vice President. Physical therapists in our communities continue to provide services to our diverse populations to improve their quality of life and to maximize functional ability. The Physical Therapy Board continues to prioritize strategic planning for operations alignment with its mission to protect the public. During the current sunset period, the board completed nearly all objectives in its 2018-2022 strategic plan. Highlights include objective tracking, cross-program participation, facilitation of public engagement, strengthening internal processes, and adoption of the 2024-2029 strategic plan. The board's implementation efforts include staffing enhancements, creating positions to support licensing operations, consumer protection, and a dedicated military liaison to assist applicants in inquiries. Stakeholder engagement includes participation in the Federation of State Boards of Physical Therapy, expansion of digital platforms to keep the public engaged, and in 2023, the board launched a redesigned website focused on improving user experience. In addition, the board participates in community and educational events, along with presentations to PT and PTA degree programs to California schools and universities. Jason Kaiser has continued to serve as executive officer, providing consistent and mission-focused leadership. In October 2023, the board enhanced operational alignment, resulting in a dedicated executive unit. by centralizing functions, responsiveness, stakeholder engagement, and governance support are enhanced. And I very much appreciate you allowing me to speak out of order.
Thank you very much. I'm glad that worked out. So with that, thought I heard the voice of God. We're going to open it up to members of the public or advocates who have any comments. As a reminder, please keep your remarks at 2 minutes. Please go ahead.
Yeah, Mr. Chairman and members, thank you. Carl London here on behalf of the California Physical Therapy Association. I want to say that, first of all, we have a great relationship with the board. I will tell you, it does not mean that we get everything we want there. I assure you of that. That's not the case, but they do a good job. For us, access to care and safety are number one. You should know that there is in California a shortage of PTs to handle the population's needs. The good news is that we have, as the board indicated, over 20 schools that are now training and educating physical therapists and PTAs, physical therapy assistants, to provide services throughout California. One of the, and the PT level, since 2015, they've been educating to the doctorate level. So they're now getting a doctorate in physical therapy. They're being trained to practice independently for patients to come in directly to see them, to do things like dry needling that was raised. The difficulty is, in this state, there is a gap between the education training and the actual practice of what they're allowed to do based on the law. Now, this law has been around since the 1950s. It has to be updated periodically, and we're kind of at one of those critical junctures, because the problem for us is that as students come out of these programs, if they can't do things that they're interested in doing, that they've learned to do, that they've been trained to do, they will leave. They will go to other places where they can perform these acts. Dry needling, as the report indicates, is allowed in 46 states. There's only 4 states that prohibit it, and California is one of them. Is that something we really need to do? If you talk about pilot projects, we've had a huge pilot project going on for years. The malpractice data, the licensing complaint data on dry needling is non-existent. It is not a problem where we're seeing problems in care that are delivered in those other states. We use the same malpractice carriers the other states. We would know that and see it. It doesn't exist. Another issue that comes up is physical therapists are being trained to know when to order imaging, so x-rays, scans, MRIs, things like that. We do not ever seek to interpret those. We do get trained to do that, but a radiologist always interprets those images. But when you're having a patient come in directly and you're trying to evaluate and assess their needs and what you can offer them treatment-wise, there are occasions where you need imaging to help in that process, because that may help you push the patient right to the other appropriate provider.
Thank you, Mr. London. If you could wrap up.
Last thing I'll say in this then is that regarding the board's push for a fee increase, we're neutral on that. It comes at a tough time. You guys know we sought legislation to curb some of the practices and prior authorization. Payments right now are not going up for physical therapists. Costs are. So having a fee increase at this time is tricky. However, we totally understand the board's need for funding to be able to do its job. And so we're, patiently neutral on that. I guess I'd say thank you.
Thank you.
George Soares with the California Medical Association. Just wanted to highlight one issue. That's issue number 6. And we're concerned with all the provisions within issue number 6 as it relates to expanding the scope of practice for physical therapists. So we'll continue to monitor that to ensure there is no patient risk with that. Thank you.
Thank you.
Good morning, chairs and members of the board. Of the committee. My name is Karen Atlas, and I am a licensed physical therapist and owner of Atlas Rehabilitation for Canines in Santa Barbara, where I work together with veterinarians helping animals recover from orthopedic injuries, neurologic disease, and surgery. I also serve as the president of the Animal Physical Therapy Coalition, representing veterinarians, physical therapists, veterinary technicians, and animal welfare advocates. I am here today because a regulatory gap that has persisted for more than 20 years limits access to care and workforce utilization. I appreciate that the Sunset Review backgrounder identified this issue under issues number 7. Across the country, animal physical therapy is recognized as the practice of physical therapy when performed by licensed PTs, with additional education on animals and under veterinary referral, consistent with the national standards established by the Federation of State Boards of Physical Therapy. However, our regulatory framework remains out of step with national standards. Licensed PTs providing rehabilitation to animals are currently classified as unlicensed veterinary assistants, requiring direct veterinary supervision. The PT Board has suggested this issue belongs under the VMB, but that approach has already been tried and failed. Two legislative efforts, AB 3013 and AB 814, with Assemblymember Lowenthal, attempted to include PTs within the Veterinary Practice Act. Both were opposed by the VMB, leaving the regulatory gap unresolved. In 2022, the VMB removed a veterinarian's ability to determine supervision levels and mandated direct supervision, placing previously lawful collaborative practices out of compliance and raising concerns about anti-competitive regulatory effects and reduced access to care. States such as Colorado recognize that PTs providing rehabilitation under veterinary medical clearance are practicing PT and remain accountable to their licensing board. No complaints of animal harm have been reported across the country, demonstrating its safety.
If you could wrap up, that'd be great.
I respectfully ask the legislature to establish clear statutory authority so licensed PTs with advanced animal training can collaborate with veterinarians. If Sunset Review is not the appropriate vehicle, I ask for your support in separate legislation. Clear rules, protect consumers, and expand access to care. Thank you.
Thank you.
Good morning, Chair and members, and thank you for the opportunity to speak today. My name is Dr. Jenny Moe. I am speaking on behalf of the Animal Physical Therapy Association's Animal Physical Therapy Special Interest Group, for which I'm the Vice President. I also own and operate a custom animal wheelchair company called Dog on Wheels. I'd like to provide a personal perspective related to, I believe, Issue 7. I've been a licensed PT for 23 years, certified to work with animals for 16, where I focus my practice in the San Francisco Bay Area. I worked in specialty veterinary hospitals in the Bay Area as part of a cohesive team. In 2018, I decided to move to State Line, Nevada, where I was able to open my own practice, as I could not do so in California due to current regulatory restrictions. The Nevada model worked beautifully to allow PTs and veterinarians to collaborate and expand access to PT services. I was able to help a wide range of animals, including post-op patients, canine athletes, neurological and orthopedic patients, and search and rescue dogs. However, I continue to face limitations as vets in South Lake Tahoe cannot directly refer to me as a non-veterinary professional without additional expense and time to the client. Upon returning to San Francisco in 2020, I've been unable to fully practice animal PT unless I'm employed directly by a veterinarian. This restriction persists despite my licensure, training, and decades of experience. The wait time is about 3 months in the Bay Area. We are lucky to have many options, but everyone is backlogged with a surplus of clients. The long delay may lead clients to find self-service options that provide a generic treatment plan that may not be safe for the patient in question, whether that be from AI, online forums, or word of mouth. Chair Berman, I actually have the pleasure of collaborating with veterinary colleagues to serve a lot of constituents in your own district. Especially along the coast, clients are desperate for in-home services and skilled rehab in general. I have submitted letters to your office alongside some of my clients and those vets to your district to support my statement today. I look forward to a day when animal PTs are able to serve our clients and patients freely under proper regulation, ideally under the Board of Physical Therapy. We hope to be able to collaborate with the veterinary field to do what we all set out to do, make the lives of the animals we love the best it possibly can be for as long as possible. Thank you.
Thank you very much.
Thank you, Mr. Chair and members. I'm Christina DeCaro, lobbyist for the California Veterinary Medical Association. I just wanted to indicate CVMA's strong opposition to the concept of opening up the Physical Therapy Practice Act, or the Chiropractic Act, which you'll hear next, to allow physical therapists or chiropractors to work on animals without proper veterinary supervision. Your comprehensive background document notes how current law actually does allow a physical therapist or a chiropractor to work on animals in a safe and controlled environment as long as they are under veterinarian oversight. And that structure has been working very well for many, many years. We see no reason to change it now. So thank you very much.
Thank you very much. Seeing no additional comments from the public, thank you for your presentation and for your answers to all the questions that were asked. And we're now going to move on to the Board of Chiropractic Examiners. Thanks so much. So for the Board of Chiropractic Examiners, we have Board President Lawrence Adams and Executive Officer Kristen Welker here today. And we're ready whenever you are.